Hey everyone, welcome back to the NPTE podcast. This is Will Crane, your host. Thank you so much for joining me as we talk through the content you need in order to dominate on test day. So as you recall, we are going through the FSBPT content outline. Today is no different. We'll be talking through the system interactions section on the exam. This only has one section. This is all about evaluation and differential diagnosis. But before we get to that, just a quick reminder that we are starting up our crash courses for the April cycle. Be sure to jump into our crash courses. This is a 3-week program meant to be like cramming, but just way better. We go through all the content of the cardio-musculo-neuro system that we can fit, the big three, to make sure that you can boost your score significantly on test day. So as you recall, about 75% of the test is determined by your performance in the big three systems, cardio, musculo, and neuro. And so that's why we like to focus on that in the last weeks right up until test day. One of the cool parts of being a part of the VIP class is that you get complimentary access to this crash course. Plus, another thing that's of note, if you are a class president or involved in your class, you can get a sweet discount if you get a group of 5 or more together. Just head over to ptfinalexam.com/contact where you'll be able to fill out the form and we can send you the discount and really help you get a sweet discount in the crash course. So as you recall, the FSBPT content outline, this is what determines what is on the test. Now, you're going to ask yourself, well, how did they come up with this outline? And it's been a while since I've talked about it, but the outline is determined by practicing PTs. They survey across the entirety of the US, across the entire practice spectrum. They want to know what it takes for an entry-level PT to practice in the US. And so with that survey data, they then are able to craft this content outline to determine what are the main or the key points of knowledge that you have to have, these key performance indicators in order to practice as a PT in the US. And so as you can imagine, the big three systems are heavily represented because that is where most PTs end up practicing, is in either a cardiovascular, musculoskeletal, or neuro setting. Now that being said, it means that you do have to have a cursory knowledge of the other systems, including metabolic endocrine, gastrointestinal, genitourinary, lymphatic, the non-systems. And today we'll be talking about the system interactions on how you bring multiple systems together and how they are presented or how they manifest in a patient or a patient case. Now, just of note as well, the FSBPT represents the entirety of the PT practice in the US, meaning that every jurisdiction in the US, so all the states and territories, they're all represented by the FSBPT. So that just means that in order to pass the exam, it doesn't matter which state you sit in, the exam is identical in all 50 jurisdictions, plus Puerto Rico, District of Columbia, all of the territories as well. The entirety of the PT practice in the US is governed by the FSBPT, or the Federation of State Boards. And so this is a good thing to note that, let's say you are studying in Missouri, that's where you completed your schooling, but you plan on practicing in Kentucky or New York or wherever. It doesn't matter where you sit for the test because the test is identical regardless of where it is that you're sitting for the test. So for instance, I had a student that I talked to recently who they'd graduated here in Idaho. They had family in Missouri. And so what they ended up doing is they ended up testing in Missouri to then have an Idaho license. I guess the bottom line, what I'm trying to say is it does not matter where you sit for your test. All that matters is that you pass the test. And so regardless of where you sit for it, it is the same test. And so today we'll be talking about the system interactions. There are somewhere between 8 and 12 questions in this section, focusing primarily on evaluation and differential diagnosis and prognosis. So without further ado, let's go ahead and dive into our practice question. As per our usual, I will read to you the question, give you a moment to respond, and then we'll talk about the answer together. Here we go. An elderly patient is receiving in-home physical therapy for functional mobility training following a unilateral transtibial amputation. The patient has canceled the previous 3 visits and reports that he is experiencing excessive fatigue, limiting his ability to move about in the home and confining him almost entirely to his recliner chair. The therapist suspects depression and is able to convince the patient to permit an evaluation visit. Which of the following characteristics will be least indicative of a major depressive episode? So again, the case is that we have a elderly patient receiving in-home care for transtibial amputation. The patient has canceled the previous 3 visits and reports he is experiencing fatigue excessive fatigue, limiting his ability to move about in the home and confining him almost entirely to his recliner chair. The therapist suspects depression and is able to convince the patient to permit an evaluation visit. Which of the following characteristics will be least indicative of a major depressive episode? The answers or the options are chronic pain and persistent polyarthralgia, 2, hypertonia and clonus, 3, presence of sleep apnea and heart palpitations, and 4, weight gain and bradycardia. So again, the question, which of the following characteristics will be least indicative of a major depressive episode? 1, chronic pain and persistent polyarthralgia, 2, hypertonia and clonus, 3, presence of sleep apnea and heart palpitations, and 4, weight gain and bradycardia. Well, the correct answer here, as you can guess, is the hypertonia and clonus. The typical manifestations or clinical manifestations of major depressive disorder include, but are not limited to, certainly high on the list would be sleep disturbances. Fatigue is maybe the highest on the list, the excessive and persistent fatigue that prevents the patient from participating in activities that would otherwise be normally pleasurable to the patient. So they tend to withdraw and be very tired. And that, in fact, that's probably one of the biggest signs you'll see is that persistent and excessive fatigue that would not be necessarily associated with the condition. Like, for instance, in this case, we're talking about a transtibial amputation. You would expect fatigue might play a little bit of a role, but it's certainly not going to be excessive to the point that they cannot even get out of the chair. That seems to be a bit excessive. So that excessive fatigue, sleep disturbances, weakness, headaches, polyarthralgia, myalgia, so they can have multiple joints hurting, they can have muscles hurting, back pain is high on the list, headaches, cardiac changes, including palpitations, heart murmurs. You can get bradycardia or tachycardia, weight gain or loss, so weight changes, gastrointestinal symptoms, so this would be like constipation, upset stomach, confusion, loss of motivation, general cognitive slowing, including the inability to remember new information. Really, there's just a whole battery of symptoms that can be present in the case of major depressive episodes or major depressive disorder. Certainly high on the list would be sleep disturbances, whether that's hypersomnia or insomnia, sleep apnea, heart palpitations. All these things can occur because you have significant sleep disturbances. Weight gain, bradycardia, chronic pain, persistent polyarthralgia. The one that is clearly not or least indicative of a major depressive disorder would be hypertonia and clonus. So hypertonia and clonus, this would be a sign of some type of upper motor neuron disorder. So usually we're talking about a stroke or a traumatic brain injury, something where you have the upper motor neurons disturbed. So that creates the hypertonia and clonus. This is the least likely thing to occur in the case of a major depressive episode. So there you go. I can almost guarantee, as far as guarantees go, maybe this is worth the paper this is printed on, I suppose. But I can almost guarantee that there will be a question about depression on the test simply because it's a great multi-system question. It's easily tested. It's very prevalent, especially when you consider the myriad of conditions that cause or can be a trigger factor for major depressive disorder. This would certainly include a lot of neurological conditions like amyotrophic lateral sclerosis, a stroke, cardiac conditions like myocardial infarctions and cardiac heart failure, congestive heart failure, any number of neurological conditions, skeletal conditions, certainly after amputations. Really, this can be extremely prevalent. And so therefore, that's where I say I can almost guarantee a question on major depressive disorder. And just remember, high on your list is that excessive fatigue. Then everything else that follows there would be cardiac changes, weight loss or gain. You'd have polyarthralgia, low back pain, myalgia. All these things are highly associated and correlative with major depressive episodes or major depressive disorder. So there you go. That's your question today, system interactions related to depression, and in this case, a home health patient or someone who is confined to their home. As always, be sure to check out our other episodes. You can check out all of that over on wherever you listen to these podcasts, whether it's iTunes, Spotify, Google Play. Plus, if you enjoy hearing the questions, you may enjoy seeing the question. Be sure to check us out over on our YouTube channel, where you can find the video format where you can actually see the question and try to ingest the question in other ways besides just the auditory way, which is good, but sometimes it's very helpful to be able to see it as well. Also, be sure to check out ptfinalexam.com/podcast, where we've got our cheat sheets. You can grab some free questions for a limited time. Be sure to check that out for all of the content you need in order to dominate on test day. And until next time, I will catch you in the next episode. Happy studying. Keep a grin on your chin. Will Crane fist pumps all around, and I will catch you in the next episode. Thanks.